One of the most rewarding parts of all this is having that the different levels of service, behavioral health patient service, available.
We're a trauma-informed hospital. We have specialists that deal with trauma in a trauma-informed care way. So I'm very proud to be part of an organization that tackles that very issue in a way that's evidence-based and is state-of-the-art. We have staff that are very experienced to evaluate, treat, and take good care of our patients.
You know, when I look through this, you know, the vision was providing safe environment with quality outcomes. So, and I think everything's about quality, safety, and satisfaction. Many collaborations and partnerships that we now have in place here. I was blessed to have the opportunity to work with county commissioners and state, local, and federal dignitaries who have all, you know, had input in what this is going to look like and what the needs are.
One of the things that is a priority here in Chester County is providing better mental health services to all 500,000 of our residents. We lost behavioral health beds when Tower Health closed Brandywine Hospital. We've also seen an increased demand and people just being more aware of their mental health and services that they may need. The county has decided to support the first behavioral health facility supported by the county in this behavioral health hospital right in downtown Westchester across from Penn Medicine's Chester County Hospital campus. We really believe this is going to provide better health outcomes for the residents that go through that facility and provide better services for our residents that they certainly need and deserve.
So what most people don't realize is that before COVID even was thought of, we had behavioral health needs in Chester County, and we invested in huge amounts of dollars before COVID. But of course, COVID necessitated more work to be done in behavioral health, and we have continued to invest in greater numbers to make sure that our community was healthy from a mental perspective. And now, with the opening of Haven Behavioral Health Center in Westchester, we're very excited to have those additional beds, those additional walk-in services, all the things that we are short of in Chester County, and we've invested millions into that for our community.
The inpatient behavioral health facility at Brandywine Hospital was such a valuable resource to us here in Chester County, and that's why when Brandywine Hospital closed, it was such a devastating loss to our community. I'd like to give a special thanks to our staff here in Chester County government and the Departments of Health, Human Services, and Emergency Services, because in the days, weeks, and months after Brandywine Hospital's closure, they really stepped up to the plate to make sure that the needs of our community were met. I'd also like to thank our Human Services staff for their connection to Haven Behavioral Health, which is a pillar within the behavioral health space that's bringing back not just inpatient services, but outpatient services too.
So then, you know, just needed a building. Mike Duncan, Chester County Hospital, let me walk in on him one day, and I said, Mike, you know, what do you think about bringing it back, you know, behavioral health inpatient back to the county? He thought it was a great idea. I said, well, you know, I just need a building. Any ideas? And pointed me across the street, and I guess we signed a lease in August of 2022, and been working it ever since.
Well, we're very excited to have Haven open. When Brandywine closed, 80% of the behavioral health patients ended up in our emergency room. And it takes a while when they get to an emergency room to find an open bed for them somewhere. And we're excited about having Haven across the street from the emergency room so that behavioral health patients can be in treatment faster and they're not waiting in an emergency room for a bed. It can be stimulating to be in an emergency room, and so the fact that we're going to get them into a nice quiet place with all trained professionals taking care of their needs is very exciting to me.
At Haven Hospital, We have the ability to take medically complex patients. So we have beds that look like hospital beds. They're Stryker beds, they're psych-safe Stryker beds. So we can take patients that have uncomplicated wounds, so we can care for them.
So I have to also give a lot of credit to my leadership staff and subsequently the staff that I've hired so far. It's just amazing the amount of compassion and just focus on the patient, outcomes of the patient, and basically a shared vision for me that you know, these professionals that we've hired here have been just wonderful at executing.
The other thing I'm so excited about is the fact that we will be a teaching hospital. I am Drexel faculty, and we have just signed an agreement with Drexel College of Medicine, and they will be sending medical students and residents here for training. We're actually going to have a full-time equivalent psychiatrist that will be on staff, working side by side with me and teaching medical students and also teaching residents.
One major concern or source of heartburn for me in starting this up was physicians, you know, like especially psychiatrists.
It's not limited to just medical students and physicians, but we will have nurse practitioners here for internships and preceptorships. We will have counseling students here for preceptorships and internships.
And the other factors there are pharmacy, nursing, and social services, and we are working towards becoming faculty and opportunities for schools rotations.
So we're very excited to have the opportunity to train the best and brightest amongst us.
Tried my best to communicate, inform every step of the way here, and kind of culminating to the first responders came and visited. One night, I think we had 42 or 49 fire, EMS, police, all touring, going through, again, providing great input, you know, just telling them, you know, what we do to keep them safe, the community, the colleagues here, the patients here, and just, you know, having input from them on that emergency preparedness and good fellowship, you know, and the EMS Council. They've had a lot of input on, you know, just the safety and the entryway and, you know, the grounds. So I really appreciate that too. So I'll leave you with, we're open, we're here, we finally got this completed, and again, the support has been fantastic, both financially, operationally, you know, emotionally, you know, from, you know, county commissioners, you know, local, state, federal dignitaries. Thankful for Haven, who, you know, financed and offered all the support in the world to get this rolling. All the work groups that we did with the county, the Psychiatric Council of the county, the EMS Council of the county, the mayor, just, you know, just so thankful. Chester County Hospital, Mike Duncan, the CMOs and the CEOs of all the remaining other hospitals in Chester County, Paoli and Phoenixville. You know, we're just here to support. We're not here to take anything away, but we want to add these services and collaborate and partner with everybody we can to make sure that the patients are taken care of and we can break that cycle.